Right now, the preferred option is to use the so-called extensively hydrolyzed diets. It's a similar approach as it's done in people. Basically, the main advantage is that there is some threshold in terms of the size of the proteins that the immune system will not be able to really identify.
Hello and welcome to the Pet Food Science Podcast brought to you by Wisenetics. My name is Jan Sogolowski. I'm dedicated to bringing you the latest insights and discussions in everything that involves the pet food science industry. So get ready to expand your knowledge and stay ahead with today's episodes. And I'm really honored today to have Ramón Almela with us. He's a veterinary dermatologist, and today's topic that we're going to discuss is food allergies, or food allergies in general, in dogs and cats, which is a very big common problem, right? And how can we address it, and how does the diet play into a role? Ramón, thank you so much. I let always everybody here, introduce themselves, your career path, how you ended up all the way from college, all the way being here on our podcast.
Thanks for the invitation, Jan, and I'm really delighted to be here sharing the information in this podcast. So I did my trainings in Europe, in Germany, and then afterwards we decided to come to the university in the US. Right now, I'm working as assistant professor at Tufts University in Massachusetts, and since then the main research lines are focused on mainly the allergies and some immune-mediated diseases. So this is my background, and I'm happy to talk about this very, very interesting and very common problem. It's a hot topic right now, all related with the food and the allergies. What actually really, really prevalent right now.
Benefits consumers want, partnerships you need. Schooler is your all-in-one partner for an innovative pet food supply. With an expansive portfolio and global access, we can source and deliver in-demand ingredients year-round. Schooler provides access to ingredients that are animal and marine ingredients, nutrient-rich, clean label, plant-based, freeze-dried, sustainable, MSC and Marin Trust certified, and more. That means you can offer on-trend products consumers want without disrupting production. Learn about the benefits of working with Schooler. Visit schooler.com/pet. That's SCOULAR.com/pet.
So maybe tell us a little bit, how often do allergies occur? And I think also for the client itself, right? There's not really allergy. There's also probably sometimes the definitions. What is an allergy? What is a sensitivity?
That's right. And actually they are pretty common in both. So since the 50 or 60 is coming right now, being called the allergy pandemic in people and pets, because it has been increasing every decade. We have more and more. Right now it's thought to be around close to 1/3 of the pets that could have any allergic diseases, and very similar in people, like around 20% of the children will have the allergies. So it's a very, very common problem and very challenging and difficult, because it affects at the end both the patients and the family surround with the disease. Very, very unpleasant, very uncomfortable, and it has very predisposition to infection and the other complications. So it's absolutely, it's a really great problem right now, and really, really common. Probably in our daily basis experience, probably I will say that around 80% of our patients have some sort of allergy at the end.
Wow,
it's very common problem. You have to be really aware. We right now as a group, we are trying, all the dermatologists, to try to increase the educations in both for general practitioners, for owners, because it's really important since the beginnings. It will help otherwise to make the patients more comfortable and to be everyone more or less on the same page, to be more effective treating these problems.
So you said over the last decades it increases. Is there a common reason? Is it suspected for this increase in allergies?
So there has been several hypotheses. The latest one and the most updated, and is more coming from human dermatology, but it seems that might be about the same in dogs, as they share our lifestyle, some of the diets, they share many factors. So it's probably very similar. So right now, the main focus is on the skin barrier problem. And whenever there's any damage, that is right now thought could be the very first event. And why that happens? There are many different factors, but for sure, it's going to be a great evidence and increasing evidence to support the factors such as the increased micropollutions, the ultra-processed foods, many other like environmental contaminations, even the use of different chemicals for personal hygiene and so on. So many different factors right now seems to be increasing, be more exposed, and that increased exposure will ultimately damage the skin barrier, and then after that we'll have increased inflammation, better penetration or enhanced penetration of any allergen because they are easy for them to penetrate and be in contact with the immune system, and then trigger and develop the further immune response that with time it gets worse and worse like a vicious circle. But it seems right now the so-called epithelial barrier hypothesis to explain this increase in allergies more with time, and right now it's a worldwide, like even not industrialized countries or not so well developed, the so-called the Western countries, or right now even in Asia or in Africa, they're increasing the overall prevalence of the allergic diseases. And that will explain not only the skin, also the respiratory or the intestinal, any sort of allergy right now is increasing. And it seems, or right now, the most accepted theory has to do with this so-called epithelial barrier hypothesis.
And it's mostly on the skin, or is it also the gut barrier too?
So again, and there is increasing evidence that there is a connection with what happened in the guts to other chronic inflammatory diseases such as the skin allergy, but both. So it seems also that in the guts, the epithelium might be affected with all these changes and affective factor from the lifestyle and so on, and then will predispose to changes in the microbiome of the flora, the normal guts, the normal bacteria that live there, and even some of those changes can affect to distant organs such as the skin and then promote or predispose. But both ways, also in the skin directly, there is evidence that the direct factor can impact on the skin barrier, and ultimately this is one of the first events that happens with all these conditions.
One question always comes to me is it a food allergy or is it another allergy against some environmental? How can we suspect that, and how it's the big differentiation? How can you diagnose and differentiate those two?
That's a very good question. I still not really answer. So there are kind of like different thoughts about that. Some people will consider, at least in like in dogs or domestic animals or pets, will consider that food allergy might be a distinct entity. Some other will go more included into the otherwise syndrome of the atopic dermatitis or the skin allergies, kind of like umbrella term that will include different diseases like asthma or food allergy or the atopic dermatitis. At the end, what happened is that, absolutely, some of the clinical signs or the symptoms that we can see in our pets could be tricky in some cases. So to pay attention, at least I will say that, for example, many of the symptoms will have, let's say, very similar to otherwise the allergies in general. And in case of the skin, it will be very similar, whether environmental or food driven. So really they share the same clinical phenotype and same similar clinical manifestations. So usually that's why we had to do a different test to rule out if it's more like the impact of the role of the food into the whole allergy problems into the patient. For example, one of the, let's say, the hallmark of the disease of the allergies and the skin allergies is the itch, the pruritus. So the itch is one of the main ones. We also have another sign that will make think of some underlying allergy problem with presence of recurrent skin infection or even ear infection, otitis, that can happen even as a sole manifestations. In some cases, besides the itch and the skin lesions, that initially will just show some inflammation with redness, like erythema, and then with time they can get infected or predisposed to infection and make more different or chronic changes. But besides that, the gastrointestinal symptoms can happen, but not in every, let's say, food allergy dog may show at the same time both skin and gastrointestinal symptoms. That it's according to the latest study, it seems that it will be around 20% of the food allergy dogs will also present not only with itch or otitis or things like that, also with like vomiting or diarrhea or changes in the stool, flatulence, or some symptoms related to the gastrointestinal tract. But not always. It's a subset of these patients. That's why still many things that we had to do better and to get more knowledge about all these mechanisms of disease. Other than the gastrointestinal signs and all the main skin allergy symptoms, sometimes you may have in some patients some respiratory or ocular, like conjunctivitis or rhinitis. But let's say events related to the like the genital system, some cases. But as a main theme, probably I will say that most will be same or maybe similar to any like the environmental allergy with the itch and infections. Plus, in some dogs, we also can also have the gastrointestinal signs.
I come back to the differentiation, GI signs, skin signs, because in the GI world, there's some new updates about diets for only GI disease. But what is the primary body side? So an owner says, okay, where is usually the itch? Where is usually the redness? On which sides of the body do you see those?
So usually the most common areas, let's say on the average, we see the typical signs will have mostly affected the face, ears, and probably feet and groin, ventral abdomen. So let's say ventral distributions up to the even the perianal and so on, and the face. Probably those will be the most common distribution areas for the itch. And also it's different. It's very different dogs and cats. So probably we're more familiar with dogs and all the itch behavior. Like for example, some cases can be unrecognized. We recently have a story with an owner that came for a different thing. Like it's more like I was worried about a lump in the dog. But then when we were like examining the dog, we saw that there were clinical clues to pointing towards some underlying very early stage of an allergic problem. So we explained to the owner, and for the owner say, well, you're right, but no, like nobody really asked me when you say the itch. Probably everyone will think of the scratching behavior, but there is more than that. And sometimes we just directly ask about itch, where it might say no. So we had to ask more descriptive factor that will describe the itch behavior. For example, in dogs, that is different. That cats will be the increased frequency or change in licking the feet, for example, rubbing the face, rubbing into the carpet or furniture. Those could be pretty behavior in dogs. In cats, it's very different. So you may see as the only sign or only clinical clue the fact of over grooming, for example. That is some pretty behavior. So we ask directly the owner, do you feel that your cat is like grooming more than normal in the last month, for example? In the dog, you feel it's more like scratching the ears or licking the feet or having infections, which is a very good surrogate marker. So sometimes we had to do better with the asking, but yeah, that's some of like some of the signs that we can see in these patients.
So observation is very important also for the owner. So now you have a suspicion of food allergies. So what is the next step?
So the next step, if we have one of the things it does from the general guidelines is that if we have, let's say, like a problem such as the itch, let's say, if this itch in the patient is non-seasonal or year-round, then come into question whether could be impact from the food or not. If it's very seasonal, probably it's much less likely, unless we're talking like maybe like horses, for example, they have very distinct type of food according to the season. But in general, for our species, dogs and cats, if it's a year-round problem, then the recommendation is to rule out the food allergy. So if we have in the consultation, we ask about the problem, we see like recurrent infection throughout the year, which is a very good marker. Plus, like itch that could be related or not with infections. And again, it's not really like a seasonal pattern. Then the next step will be to rule out the food. And right now, and this is a great question because we have so many different like outdoor like testings or offering like marketing around how to diagnose the allergy. And actually, for any veterinary dermatologist will say that none of them are reliable, not like taking saliva or hair, or there are serum tests as well that is also offered. But at the end, in our species, dogs, cats, and of course in horses and other species, the only way to rule that out or confirm is by doing what is the so-called the elimination provocation diet trial that we can explain later.
So let me maybe emphasize it again. So there's no diagnostic tests that are value of value at the moment, only a strict elimination trial with a diet, correct?
That's right, and that's it. We wish, because it's much easier that doing the trial, which it's not very easy test. But at this moment, thus far, for our species, there is no other really reliable test that we can use for that. In people, it's different because also the pathogen, the mechanism of the disease involve different immune pathways. But for our species, we have a mixed immune response. Probably at this point we need something different, but the only right now thing is this diet trial.
Okay, so how do you do a proper diet trial?
So one of the things when we see a patient and we deem that most likely is an allergic patient and there is no seasonal pattern, so we have to rule out the food before going to all the management for environmental allergies. In that case, it depends how severe are the lesions. For example, you have very, very severe and chronic lesions. To be able to assess at the end of a food trial, we have first to bring the patient into comfort and to resolve most of the lesions that might be easier to detect changes in terms either for the lesions or for the age. So if the patient is otherwise with very mild signs, we can start it right away. So it depends the stage and the severity of the disease. Let's say that now we have a patient is fine with all the lesions and everything is much more controlled. In that case, usually the general plan is like a two-step approach. The first step involves using reliable diets that could be used for the first step in the so-called elimination step, which usually involves at least around 6 to 8 weeks, has been changing through time. In the old times, there were events because it was different approach, even like a 3 months. Right now, we are trying, because it's not really easy for the owners, to do as short as possible, but balancing the diagnostic, let's say, power also with the compliance, making otherwise like a test that could be feasible. So right now, in general, it's around 6 to 8 weeks on average. And in that time, we treat the patient the first weeks because it's not really something that even in food allergy dog, they might not respond really quick. So we have still to keep the patient under control. So we'll keep with the treatment and start with the diet. The main thing here is to avoid in the first step the main pitfalls. Basically, we are trying to kind of like a washout period. So we use a diet that we are very confident that not going to trigger or develop any immune response. So then they see the whole thing about what diets can be used. But let's say we find the diet, we start with the diet, we still do the anti-allergic treatment. And then at one point, after 3 or 4 weeks, we just leave the patient only with the diet as a unique factor to see if that will be the first end time point that we can use. Because if after like 5 weeks without the medication start to relapse, then in that case we can stop the trial. It's very unlikely to be the food, and we just continue with the environmental management. Let's say that nothing happens, so it still could be bad. So it's essential. It's something that we also see a lot, the lack of the provocation that will confirm. It's really important because there are so many factors that they happening at the same time for an allergic patient that the only improvement that's not sure that we can, this is because of the food or the food allergy. So we confirm after that with the previous diet. And then the confirmation of food allergy will be that upon the previous diet, the patient would relapse. If it's not relapse, then again, food allergy is very unlikely. So those are kind of the overall, in general, how is the procedure, this diagnostic test is done.
So 2 questions. So all confirmation, the provocation, you would start around 6 to 8 weeks, correct?
Exactly. That's right. Exactly.
The question comes, obviously, there's not a perfect diet
Yeah.
using as elimination diet. So how do you choose the diet? Are you going for hydrolyzed, ultra hydrolyzed, normal protein? There's so many different factors, I would assume.
Exactly. So one of the things is that we also instruct the owner at first that make sure that they don't give any treat. Sometimes we check supplements or toothpaste, even the flea preventives, we change to something topical or something that will not interfere with the overall test. So be really strict. It's very difficult, but it's essential to have meaningful outcomes. In terms of the data has been shifting through time, probably according to also the progress in the industry and the options out there. Right now, the preferred option is to use the so-called extensively hydrolyzed diets. It's a similar approach as it's done in people. Basically, the main advantage is that there is some threshold in terms of the size of the proteins that the immune system will not be able to really identify. And usually some cutoff is sort of around, let's say, less than 1 kilodalton or so on, 1 to 3 kilodalton. So to get that, the protein has to hydrolyze or broken down into tiny either like peptides, oligopeptides, or even amino acids. So let's say with this size, it's very unlikely that there will be any immune response. So this hydrolyzed diet has the advantage that even if you don't know the whole nutritional history or has been adopted, we don't know in the past what have taken, or otherwise we have like 10 different diets, so no really novel diet protein is possible. We don't know sometimes about the cross reaction. That's another issue, and still we don't know many things about feedback. For example, in vitro, it is well known that fish can cross react with chicken, for example. So due to all this, it seems that the very practical the hydrolyzed diet. Let's say, but some people it's too expensive, or they cannot, or for any reason they are not preferred, or the owner will prefer something. Then there are two other options that has been done, and still is another approach. First is the home cooked diet, which has been in the past be actually the only option. So many years ago, the only option were to make to talk to the client and then select what kind of the home cooked diet could be done, and then selecting, for example, you should go to the groceries and just buy for example, like rabbit meat, and then put it only with this kind of stuff. At the end, the main problem was you need a nutritionist to make like proper formulated home cooked diet, not to lack in terms of the energy or the specific deficiencies. That's the main problem. Besides, it requires much more effort and time that right now is very difficult. So the other approach that is also very commonly used nowadays is the use of novel diets. So these so-called novel diets has been through the time changing, and it also depends mainly in the nutritional history. In theory, it's like trying to detect something that has not been eaten or exposed before, and with the main, and also taking into account some cross reaction, which could be difficult in some cases. So not perfect, neither diet, but probably with taking all the advantage and disadvantage, probably at least what we typically recommend and we prescribe are these extensively hydrolyzed, because all the diets, again, are manufactured with the same degree of hydrolyzation and contamination. So we tend to rely on those really extensively hydrolyzed diet that for us and for many dermatologists seem very practical and circumvent some of these challenges.
Two questions maybe, just to clarify. So is actually mostly the protein that is the major culprit, or how likely would it be, or how common that another ingredient could be the reason for the allergy?
So it seems that, and for most of the, according to the evidence and when we talk with other peers, that actually the protein is the main source from the development. So we take more into account the protein sources, and has been changing through time, because some people will get someone and say, I changed the diet to something without chicken and it still is itchy. I say, well, we cannot be known in advance. It's similar people. We cannot. The people or dogs can be allergic to anything. Of course, there's some more common allergens, but these common allergens change through time. So it's difficult to know exactly. So just changing the diet is not enough to really prove or rule out any food component for the allergy. So they can react mainly for beef, lamb, chicken, dairy products, and some of the common ones. But you can check and you can test, and sometimes you have even for any kind of proteins, it could be possible to be reacting to.
So in your personal opinion, you go always for hydrolyzed diet first, because that's easier to go.
When I was doing the residency, we used a lot the novel diet because it seemed very reasonable and it was easier and more palatable in some cases. Right now, in the setting that they have been improved in many of these hydrolyzed diets, it's easier. But with time, with the gaining evidence and experience, and with other and discussing with colleagues and so on, it seems that it's a very common approach used now for dermatology. And for my opinion, I think that's a very good approach, because you actually can really make sure I'll be really confident that you are not triggering any immune response using this hydrolyzed diet. Of course, we don't know, it might be even like reaction to small pieces of protein like peptides, but seems very, very unlikely compared to the others.
Pet food palatability, pet nutrition, and pet food protection are critical concerns all around the world. That is why so many pet food manufacturers rely on our mastery in providing these three essential components. At Simrise Pet Food, we offer pet food manufacturers what they need to deliver the quality consumers demand for the pets in their family. Beyond high-value ingredients, we deliver expert support and comprehensive capabilities to help them grow or strengthen their business. Contact us today to know more about our products and services or visit petfood.simrise.com. That's petfood.symrise.com.
How about cats? I mean, changing diet in a cat can be very tricky. What is your approach there?
To be honest, sometimes I have, in my experience, sometimes has been more problems with in some dogs than cats. Of course, cats we know that they are can be really challenging, but we did like years ago. We did part of a project trying to develop to test a new hydrolyzed diet in cats, and actually, to my surprise, 80 to 90% of the cats will rarely eat the food. So in terms of the cat, yeah, of course, can be challenging. At the end, any challenge with a patient, either with dog or cats, there is something that we can improve. For example, we can use some additive, something to entice, for example, using some vegetable oils, then heat it with a microwave, or just to make if the cat or the dog is more used to the wet or canned food, we can use water to soak and then make more like a different texture, because usually many hydrolyzed comes to the kibble into dry form. So wet form is more for novel diets. So at the end, you may even thinking of something that wouldn't interfere with the test, but for example, in some cases we have used boiled calamari, for example, things that would be very unlikely to trigger a response, and at the end could entice or be better in terms of the increasing the palatability with dogs and cats. But at the end, cat is very similar in terms that the approach are the same. The difference is in this case more related to the symptoms or the clinical signs that we see that are different, because we have different skin reaction patterns in cats with allergies. The procedure itself is very similar. It's about the same time length and using even kind of the same type of diets.
So let's assume you have diagnosed successfully food allergies. So you know for sure, you identified the former diet was it. So how are you gonna move forward? Is there cure? What's the chance of likelihood of ever improving? Are those patients gonna be forever on the diet? What other supplements? What other kind of things we can add?
So there are several options that we offer to the clients, and it will be more into the preferences. So for example, many owners will just remain on the diet because it's keeping the patient, their pet under control, which has been a nightmare for them, dealing with the problems for so many years. They prefer to keep doing the same diet because it's working. And if the owner is interested, usually the other step that can be recommended or done is to do the so-called sequential challenge, which basically implies to do in single or individual challenge to previous diets, or after the history, selecting what has been the protein sources, and then one by one single challenge to see which one reacts. And then the reaction, or those that react, then just will be avoiding that protein or that diet in the future. But some drawback is that, so another complication, the food allergy at the end we are speaking will have the sense that it's not that easy as we think. The other thing is that some patients might get sensitized to new diets. So if we change the diet, it's possible that with the years they can get the new sensitive to these diets. Or in some patients, this is unknown, the real rates or outcome in patients that it can be cured, or say at the one point that they will be resolved. Might be some people will report that it is possible, but in real life, probably it will be the least and very rare. So most of the patients will have to remain to a specific diet that we are sure they're not going to trigger a reaction, either with the same elimination diet or doing this sequential challenge.
In the GI world, we're kind of now moving more into multimodal therapy approach, knowing that it's probably many different things wrong at the same time. So do you think for those diets that are designed for food allergies, are there other things that we can add, like, I don't know, omega-3 fatty acid, things like that maybe can be beneficial?
Yeah, so usually, you're absolutely right. At the end, we have an allergy patient, and it will depend of, let's say, the clinical manifestation for that patient might be different, and sometimes will require extra intervention beside the diet. It's true that means many of these diets will have in any case, increased amount of antioxidants or omega-3 or omega-6, the unsaturated fatty acids, that will help for sure, because it's, again, linking with the first question, the skin barrier seems to be the key. So whatever helps with the skin barrier integrity, like the amino acid, the fatty acids, of course, they want to help with inflammation and restoring the skin barrier. Let's say that some patient will have like either feet or ear involvement, and sometimes in these areas you might need some regular, proactive, even like once or twice a week, extra anti-inflammatory intervention, topicals most of the time for that. So it depends. If only with the diet we feel that we need any supplement in terms of the fatty acid, that is a very good idea. And also taking into account the aspect of the patient, for example, if some specific areas like the ears are involved, and we need an extra intervention for that. But you're absolutely right. In general, for the allergy, for both people and our species, the multimodal approach is the preferred ones. And that's designed also tailored to the patient, as we know that every patient can be different. And still, we don't know that a specific subpopulation of allergic patients that may have some differences in terms of the mechanisms of the disease. So to address all of these is very patient-centered, and then addressing all the different things that can help with the overall control of the allergy.
Makes perfect sense. So maybe it's a difficult question, but if you could design the perfect diet, what it would be?
So in terms of, if, let's say for elimination diet, let's say like two different things. Let's say for the overall like diet and functional diet or elimination. In elimination diet, probably I will go like similar approach, like making sure that we have first the diet is manufactured with a different pipeline, different line compared to others to avoid any contamination, and in spite of that, to make sure that we have very like low molecular weight even to the amino acids. Sometimes the amino acids based diet seems a challenge, at least for manufacturing. So I will be more increasing the technology to be able to do that. For overall functional diets, one of them are in my residency, one of the projects or research projects was actually seeing the oxidative status, or the oxidative stress in allergic patients. And for both food allergy patients and environmental allergy patients, the oxidative stress was really increased. So for sure, we know that the antioxidant is playing a big role in or should be one of the things that probably I will design a diet. Besides the increase of course the fatty acid, which right now seems that probably the ones with the coming from fish, or let's say fish oil, for example, the omega-6 will be more interesting, but still there is a lot of research on that to find what could be the best ratio and amount of the different fatty acids that will be more helpful for this disease. So besides this specific factor, the only thing that right now is on the trend, and also it was part of one of the previous another research line that we will see if finally we can keep going or in a different way, is that analysis like using the microbiome findings, like in people to see what, if there is anything as prebiotic or probiotic that can help for the overall, let's say, normal populations in the gut microbiome that will decrease the amount of distant microinflammation. So those probably will be my line of research to do better with all these diets.
Well, I know that in Switzerland, in Zurich, there's a big study ongoing to adding fecal transplantation, but mostly for atopic dermatitis. But actually, it brings me to maybe a final question that always interests me from a GI perspective. How much of let's put it this way. So you know that one diet triggers food allergy, right? How much of this diet in grams, or is it a lot or little bits, can really reserve it? Because that's also the question for me. How much can an owner feed from something that is allergenic? Is it really minimal amounts? Do we know that?
That's a very interesting. Actually, the short answer is we don't know. Okay. Actually, we don't know, and there is still probably some research. We'll go through that. It's basically based on overall experience, but nothing with like report or evidence, scientific evidence, to detect what could be the minimum amount that will trigger an immune response or an allergic response. It seems different, for example, for urticaria or anaphylactic type 1 reaction. It seems that the amount could be very minimum, a very small amount. Otherwise, in general, for example, we recommend and the provocation trial and so on, it's even like a 25% of the meal. So, and we're increasing like with time, but the exact amount is a no. So basically, on general recommendation is when you do the provocation trial to go back or to want to test any specific protein or diet, is to be kind of like similar to will be at least 20% of the meal that is usually taken in general terms. But the set amount, it is unknown for most of the reactions, and still there will be another gap of knowledge that should be a research, of course. Yeah.
It's time for our famous three. Kemin Nutrissurance is compelled to provide safe and delicious ingredients to improve our pets' food so they can have the best quality of life. Every day, they deliver specialized expertise, innovative products, and unrivaled support through the pet food and rendering value chain. From oxidation control and food safety to palatability and nutrition, all the way through a suite of tailored services that support you from start to finish, we ensure you're getting the most from Kemin ingredients. Kemin is compelled by curiosity to ensure pets around the world are living happy and healthy lives.
Perfect. We are pretty much at the end of our time. I have a final question to you. You just told me before that you were at the World Dermatology Congress, right, in Boston. So
Yes.
What are the highlights and what are you most excited about? What was the highlight that you think that's going to really change the field?
So in terms of the food allergy, and I see one of the updates for the food allergy, has not been a lot of advanced updates since last year. Basically, at least one of the highlights were in terms of the infectious diseases and autoimmune diseases, were kind of the most of the, at least talking with everyone else, were the most interest and more updates in that sense. In terms of the allergies, basically kind of like some updates in terms of the reports. The latest one were basically focused on the length of the food trial, for example. We know that actually we're using that approach, shorten with giving the anti-allergy drugs in the first 3-4 weeks and then stopping them. That will allow to do even like around 6 weeks elimination trial for the first step. In terms of the other evidence, like the minimum amount to, like we were saying, the minimum amount that will trigger immune response, or better knowledge of the real threshold for the molecular weight and cross reactions. So not really a lot of changes. I have heard, see the positive short communications and main lecture for that. And yeah, it was mainly after the latest publication in the last year, couple of years. But yeah, most of the, I would say, my main, let's say, for when I got back to the clinic, will be mainly focused on the management and some about the probably the age and some autoimmune diseases like lupus.
So with that, Ramon, thank you so much for being with us. It was very enlightening.
Yep.
So with this, I would like to end our podcast. Another episode of the Pet Food Science Podcast brought to you by Wisenetics. Thank you for joining us today. Don't forget to subscribe so you know, always aware of future episodes. And until next time, my name is Jan Sogodowski, and see you on the next Pet Food Science Podcast. Bye-bye.